Hello, everyone. I'm excited to share the research I've been conducting over the past year into potential racial and socioeconomic inequities in Massachusetts food retail closures. And this work was done under the advising of Dr. Kevin Lane from the BU School of Public Health. I'd like to begin by establishing why food retail closures are an issue of public health importance, and this comes down to the issue of food access and the food retail environment. Unhealthy food environments can come in multiple forms. One form would be food deserts, and these are areas where there is not access to healthy, fresh foods due to a lack of supermarkets in the community. And there are also food swamps, and this is like the image on the right, which would be a high concentration of unhealthy food retailers, such as fast food restaurants and convenience stores. Both of these environments are associated with negative health consequences, such as an increased rate of obesity, whereas a healthy food retail environment is associated with positive health effects, like a lower rate of obesity. And both food swamps and food deserts are also more likely to occur in low-income communities and communities of color. This project is looking at food retail closures, changes to the food retail environment across the Commonwealth of Massachusetts, as well as looking at 2020 closures specifically within the town of Boston. 2020 closures are of particular interest due to the COVID-19 pandemic, which had economic pressures such as shifting food retailers into delivery and takeout services, which is anticipated to cause a higher rate of closures than in previous years. Health impacts are not a focus of this study, but inequities and where closures are occurring could be a cause for widening health disparities or continuing health disparities into future years. The data for this project was queried from Data Axle Reference Solutions, which is a private company that provides access to US business census data to organizations like BU. I queried all verified food retail businesses and as well as food retail closures across the state. And these businesses were additionally queried because we want to look at the quantity of closures in different areas, as well as the concentration, both by the concentration by open businesses, as well as by population. And this is because a closure of a supermarket that serves 50 people will have a different health impact than the closure of one that serves 500 people. And on the right, you're seeing what this data looks like. And you can see for each business, there's a lot of different information available. The most pertinent information is the latitude and longitude, because that's what's used to map these businesses to their census tract so we can understand how the racial and economic composition of that area might be informing where closures are occurring. In terms of getting specifically food retailers, we use these 5 NACS codes, which is the North American Industry Classification System, supermarkets, convenience stores, full and limited service restaurants, as well as fruit and vegetable markets. And these were selected based off of the CDC Healthy Modifiable Food Retail Environment Index, which is used to classify communities as food swamps or food deserts. As I mentioned, we analyzed specifically closures in Boston in 2020. And this was done because across the closure data, closures were included for up to approximately the last decade. We want to know specifically the instances in the pandemic. So within the town of Boston, I individually Google searched each business to classify whether it occurred in 2020 or not. And you can see the sources that were used for that classification: Google Maps, Yelp, and Eater Boston, to determine when a business actually closed. For the inequities data, in terms of the economic variables, we used economic residential segregation, or ERS. And this variable compares the number of high-income households with an income above $100,000 to the number of low-income households with an income below $20,000 within a census tract. You can see the equation at the bottom of the screen. A value of 1 would indicate that there are many high-income households and very few low-income households in the area. And a value closer to -1 would indicate that the proportion is much more low-income households as compared to high-income households. A value around 0 is interesting because that's indicating there's actually a good mix between the high and low-income households in that area. Now, if we look at the map on the right, we're seeing economic residential segregation across the town of Boston. And I want to focus on the stratum that are present in the legend in the left of that figure. As we're going from 0.5 to 1, that would indicate that there is a high income composition of those census tracts. Going down to 0.1 to 0.5, that would be more mixed, but also higher income. -0.1 to 0.1, as I mentioned, would be a good mix, some high income and some low income households. And then as we're moving towards -1, we're getting into a more low income economic composition. And the map on the left is of redlining across Boston. And redlining was a policy across the United States and in Boston, a racist policy which classified areas as hazardous for investment, declining, or strong investments based on the racial composition. So Black and Hispanic communities would have been classified as poor investments, and white communities would have been classified as strong investments. And you can see that this racist policy is having effects today, with areas that were classified as poor investments continuing to have a low income economic composition, and areas that were classified as strong investments solely based off of their racial composition having more high income composition. So you can see that this policy from 60 or 70 years ago is continuing to have pervasive impacts today. Racial residential segregation, and specifically Black racial residential segregation, was also included in this analysis. However, I don't have time to talk about it within this presentation, and the trend was not quite as clear as what we were seeing for the ERS variable. Now moving into the actual results, what we're seeing here is a map of Massachusetts with the concentration of closures by population. And you can see that the deeper purples, the higher concentrations of closures, are present in the urban centers of Springfield, Worcester, and Boston, but that across the state, there's been a burden of closures, even in Western Massachusetts or along the Cape. And over 70% of census tracts in Boston saw at least one closure in approximately the past decade. As we look at this data across strata for economic residential segregation, a clear trend becomes apparent. You can see that in those lower income census tracts, there's a far higher burden of closures per population than in that highest income bracket, with the more mixed income tracts being somewhere in the middle. So there's a clear trend happening here, with the lower income communities, which are already struggling with food access, seeing a higher burden of closures per population. As we shift to focus on that Boston analysis, what we're seeing is that the trend is fairly similar. So on the left, we're looking at all closures in Boston across those levels of economic residential segregation. And on the right, we're seeing specifically closures that occurred in 2020. And you can see that there's a similar trend between these two graphs, which would indicate that what we're seeing at the statewide level with higher burden in lower income communities could be expected to be the same in 2020. What we're also seeing here is a different trend than what we saw across the state. In Boston, higher income and more mixed income census tracts had the highest burden in comparison to lower income areas. Again, you can see that the highest income group did have no closures, so there's still some privilege among that wealthier area. But in general, the trend is very different, and this isn't necessarily surprising. This is just indicating that these issues need to be understood at a local level. Boston has variables that make it different than any other area in the state, as a travel industry, a tourism industry, and a lot of student populations that could make the stability of its food retailers different than other areas like Boston, or like Worcester or Springfield. There's several limitations I want to mention. The timing of closures is a major issue. We don't know exactly when these are occurring at the statewide level. The methodology of data axle is also unclear. We don't know how often they're updating this data set or what exactly they're using to determine when business is closed. A thorough cleaning also could not be conducted of this data due to the sheer amount of error, although this was attempted to be accounted for within that Boston analysis. And going forward, stronger methodology is needed to classify closures as opposed to someone just manually identifying whether it closed in 2020 or not. Also, we want to look at more variables. In addition to Black racial residential segregation, looking at Asian and Hispanic residential segregation could reveal some new relationships, as well as looking within the economics aspect at the percent of the population below the poverty line. And also we want to understand how these closures are affecting food access, not only where they're occurring, but are they occurring in areas that are already food deserts or food swamps? And one exciting element from this research is that the data that was created is already being used by other researchers at the School of Public Health to characterize the food environment around Boston public housing, which just demonstrates how this exciting data can be used in a lot of different ways to help people live better lives. Here are my references. Thank you for your time, and I'd be happy to answer any questions now.